Vaccine hesitation and misinformation persist even as the COVID vaccine rolls out, with tens of millions of Americans now inoculated. So the California Department of Public Health is staying the course and keeping diligent when it comes to putting the facts first to cancel out the false info. Epidemiologist Dr. Erica Pan has more on the state's effort to vaccinate all 58. We've been talking about the vaccine for months, and now that we're a few months into the new year, many still may not understand exactly how the vaccines work.
Sure. So vaccines in general work by providing information for your immune system to react to and respond and be able to, when exposed again, fight against that infection in the future.
And there are currently 3 vaccines that are being used here in the U.S. that have approval. Can you explain the differences between them?
Sure. So there's 3 major vaccines, as you mentioned. There's the Pfizer and Moderna vaccines, and those are both 2 doses, either 3 or 4 weeks apart. And then there's the Johnson & Johnson vaccine, which is actually just 1 dose. Sometimes we call it the one and done vaccine. There's some other differences in the way they're stored. So the Johnson & Johnson is easier to transport, and of course, just the convenience of having 1 dose. But what's really important for everyone to know is that they're all effective and they're safe. And again, we really need all Californians to get vaccinated to really move us beyond this pandemic.
When will everyone finally be able to get the vaccine?
Yeah, we're really excited to share that as of April 15th, everybody 16 years of age and older, which is the age group that the vaccines are licensed for, are eligible for vaccine. That being said, it may take some time to schedule an appointment and get those appointments, but everyone will be eligible and will be able to start being set up. We still will have many more people eligible than vaccines. We're getting a little over 2 million a week, and we're still balancing that, but we really want people to know again that it's safe, it's effective, and to definitely sign up when it's their turn.
And there are privacy concerns around the vaccine. Are they doing anything with your information when you become vaccinated? People, very private about their information.
Yeah, great question. And we want to assure everybody that we do have what we call a California Immunization Registry. And we actually have been trying to get all vaccines, not just COVID vaccine, in there. But it follows all the normal security and privacy that any medical records would have. And we are take all of that very seriously as far as making sure all of that data is confidential. It's really only there for other healthcare providers that might need to find out if somebody's been vaccinated, and for us to look at our overall progress as a state on how many people are vaccinated and who's getting vaccinated.
And can you clarify if there's a right or wrong place to get the vaccine? People may think, I have to go to my healthcare provider, or I can't utilize some of these other options. I mean, what's the truth when it comes to that?
I think, for the most part, I think for most people, really the first appointment you can make and the most convenient for you is really the best answer. I think for people that do have a history of any kind of severe allergies or what we call anaphylaxis to anything in the past, it probably is better to go to a brick and mortar clinic as opposed to one of these mass vaccination sites. But all of these mass vaccination sites do have, people on site who can deal with any kind of reactions. It's very standard to wait for, 15 minutes or so after the vaccine. And the really important thing to know about this is there are these rare responses sometimes with an allergic reaction, but all of them have responded well to medication. Sort of, most people have heard about an EpiPen, right? So it's the equivalent of that. And all of the people who have had those reactions have actually responded well and are fine. So it's very unfortunate when it does happen, but it's very rare. And certainly the benefits of the vaccine and not getting COVID far, far outweigh any risks of the vaccine.
Well, that is really good to know. And finally, Doctor, why are you advising people to get vaccinated, especially for those people who may be hesitant, or if they think, I'm already wearing a mask, I'm social distancing, I'm going to be fine?
Yeah, it's incredibly important for us to reach what we call community immunity or herd immunity as a state and as a country. And the way we can get there is for as many people as possible to get vaccinated. It's also really important for people to know there's really encouraging data for 12 to 16-year-olds. So we do think that will be available in the near future. But our kids, 0 to 12-year-old, we don't have a vaccine quite yet. They're starting to do trials, and we are optimistic that those will be available later in the year or early in 2022. But in the meantime, we all need to actually get vaccinated to help protect our kids who definitely have not had a serious of infection or illness, but we want to get to what we call, again, community immunity to make sure we can move beyond this pandemic. If we all want to get back to our normal, and also just on a very personal level, one of the best experiences I just had was my parents have been vaccinated and they were able to hug my kids again. And, really I've been also talking about this is the pathway to hugs, right? We really want to get back to being able to be social again. So the more people we can vaccinate, the more we can be normal in all settings.
Very good, Dr. Pan. It's always good to get the right information out there. And if you want to learn more, you can visit vaccinateall58.com.
This interview involves commercial content. The products and services featured appear as paid advertising.